As DPI's only healthcare consultant, I've been responsible for developing the infection control and mitigation measures for schools in conjunction with the Department of Health Services. I'm also overseeing development of tools for school nurses and others to use to implement these measures. Schools working together with local public health departments have an important role in slowing the spread of diseases and protecting vulnerable students and staff. The goal is obviously to return to more traditional forms of teaching and learning, provide education and related services while also preventing or minimizing further or future school closures due to COVID-19 or other communicable diseases. Again, as we return to school and look at the fall, we are also going to be looking at influenza season, so we need to keep that in mind. While the virus that causes COVID-19 remains in wide circulation and the general public remains susceptible, the mitigation measures, as Stephanie had mentioned, of social or physical distancing, use of facial coverings, hand hygiene and cough etiquette, quarantine of exposed individuals, and isolation of those with symptoms or illness provide the only protection to students and staff. The more individuals or a student or staff member interacts with, and the longer that interaction, the higher the risk of COVID-19 spread. The degree to which a school district is able to implement the measures of social distancing, cohorting students and staff, conducting regular cleaning and disinfection, and teaching, encouraging, and supporting the proper use of facial coverings, hand hygiene practices, and cough etiquette will directly affect the risk of transmission of COVID-19 in the school setting. These practices will also have a direct impact on how many individuals are exposed and how many individuals, both students and staff, which will be required to isolate or quarantine at home. All decisions about implementing school-based strategies, again, the social distancing, the surveillance and use of masks should be made locally in collaboration with local public health officials who can help determine the level of transmission in the community. School plans should be designed to complement other community mitigation strategies to protect high-risk populations and the healthcare system and minimize disruption to teaching and learning and protect students and staff from social stigma and discrimination. Lately, I've been kind of getting on my soapbox, if you will, with the messaging that I have taken from Harvard's Global Institute of Health, and that is that the single best policy to support school reopening prior to the development of a vaccine or treatment is the suppression of COVID-19 to near zero case incidence via testing, tracing, and supported isolation.
Our next speaker is Louise Wilson.